YouTube. This is Nixie. They called me at 9:25 and said they had their cancellation and asked if I wanted to come in. I told them yes. So we were out paying bills and doing some last minute stuff. So we're finishing up right now paying, and then I'm going to go home, grab my stuff, and go on to the hospital. Update you in a little bit. Hey YouTube family, this is Nixie. I am on the loser's bench. It's been kind of rough the last couple of days. I'm doing good though. Just all the medication makes me sleepy, and so I sleep a lot. This is Wednesday. I get to go home today. I've ate some chicken broth and Jello, the clear liquid stuff, and some juice. So I'm doing good. I've been walking. They say I'm really doing good. My nurses really said I could go home yesterday, but Dr. Mancini wanted me to stay another day, which, you know, he's very conservative, which I'm happy, you know, that he is. It makes me feel secure. So I get to go home today though, which he said I would, but and I'll be glad because I can go home and sleep. You know how it is in the hospital, they wake you up every so often. I will say though, the Binding mouthwash really got me through that 24 hours where I couldn't drink anything after surgery because my mouth was so dry. I rinsed my mouth out with water, and then I would swish that around, and it helped it a lot. It helped keep it a lot. But here's a look at my room. You know, I know some people do that. It's private. A private room. So, but I just wanted to add this. I'll talk to you guys later. Love you and bye. Hi guys, this is Nixie. I'm at home now, if you can tell. I got to go home about 1 o'clock today. Dr. Mancini came in and talked to me again, and I was drinking and walking good and everything. So he asked me if I was passing gas yet or had a bowel movement, and no, I hadn't when he came in, and I wasn't in too much pain. I had some pain, but not a whole lot. The medication and walking, I think, helped a great deal. But 20 minutes after he left, I started passing gas, so that was a good thing. I got to come home about 1 today. So I come home. First thing I did was take a shower because they have these sticky things on you and you carry around, and it's attached to this thing that you carry in your pocket in your shirt, and it monitors your heart rate and your breathing, and they see it at the nurse's desk. But they were itching me to death, so I don't know if I was allergic to them or if my skin was just over them having it on for 3 days. So I come home and scrubbed really good. Yes, I could take a bath. I just couldn't like scrub my spots, which I have 6 holes, or whatever you want to call them. But I could wash them gently and just dry them off easy. No lotion or anything. I could put Benadryl cream on them if it was itching, but they actually haven't been bothering me, so I haven't messed with them. I'm eating about sometimes 1/4 of a cup of broth and some Jello 3 times. That's what I've done yesterday and today. Excuse me, and I'm burping some, but I am passing the gas, which is good. I got to come home. When I got home and got settled and I took a little nap, me and David went outside because it was like 50 here, and I bundled up and we walked up the driveway and back, which was really nice to get some fresh air and get out and help get more gas moving. But I'm walking in the house every hour. I get up and walk a little bit, and David watches me because I am still kind of druggy and everything. But the pain is not bad at all. It just feels like I've done a whole bunch of sit-ups with my stomach when I move, which that's just them manipulating the muscles in there and everything. Everything really happened really fast Monday. Like I said previously, they called me and they had a cancellation. At the time, I didn't know it, but it was a friend of mine. Me and Kay had been looking forward to going through this together. She was scheduled earlier that day. She was having the sleeve, but she caught a cold and had a real bad cough. And so they didn't do her surgery, which they don't need to after experiencing with my stomach and everything. I understand, and trying to breathe and stuff. So everything went really fast because they did have that opening. I went to registration as soon as I went. They sent me up with the papers, and then they took me. I sat down for a second. They got me, and they took me back. I talked to Barbara, my nurse. I wanted to kind of video some of this stuff, but it just all happened so fast, which I think was kind of good with my nerves because I didn't have time to really get nervous. But she asked me the basic questions, medicine, when I ate last, and all that stuff. Then I got completely naked. You have to get completely naked, and they give you a gown and socks and purple socks to put on. And then she asked, after I got dressed, she gave my clothes to my family, and they all gave me a hug and everything. And they had to go out to the waiting room. Of course, my husband and my children were there, and my friend Charlotte came and sat with them too. Then they took me back. I was in the waiting area. Gosh, not even 20 minutes, I don't think. They gave me a shot for blood clots. They do that. They give you shots the whole time you're there. I didn't know that. Lexium, I think is what they were calling mine. And they gave me that. Then they gave me Tylenol. It helps with the swelling and the pain. And I got 2 IVs. I didn't realize that in both arms. They give you 2 IVs, and then the anesthesiologist. I had a whole team of anesthesiologists. There was like 5 of them, which I thought was pretty neat. They were all nice and promised me I wouldn't get sick, which, knock on wood, I haven't had any nausea or vomit. Well, I did have some nausea when I first came out, but I think that was more from the pain because they gave me pain medicine and then it went away. Then Dr. Mancini came and spoke with me, and he said, I'll see you in a few minutes, and I said, okay. And then they made sure all the paperwork was signed, and then they wheeled me back. Of course, the doctor, and he was kind of cute, the little anesthesia guy, one of them. He was very nice. I will say all the people at UT was very nice and took very good care of me. I would not mind going there again. He said, this is going to make you sleepy, and it made me sleepy, and I kind of remember them put my arms in some, to hold them as they do in surgery, and oxygen mask, and that's all I remember. Next thing I remember is being wheeled out and seeing my friend Charlotte and my daughter Michaela, and, the rest of the day, the medicine and everything, I was just out of it, so I really didn't get to, remember anything else for me to tell you guys. But I did get up and walk that night and went to the bathroom by myself. I did walk up and down the hallway. And as they say, walking does help. My feet are a little swollen, and I think it's just from me sitting, because I don't sit or lay normally, even though my bed moved and I did get up and walk. But they come in. I'm excited about sleeping tonight and not being disturbed, even though I can't sleep with my CPAP machine. I'm going to sleep with 2 pillows, and hopefully that will be good. Because they come in, it's weird, they come in and take blood. It was like 1 o'clock every night. They would come in and take 2 or 3 vials of blood, or it seems like, well, I know they took at least 2. And I know they have to test it. And then they also check for sugar. I didn't realize they would do that, even though I don't have no sugar problems. They check for sugar every so often. Of course, vitals and all that stuff. But also, this is the little thingy. I don't know if I showed y'all earlier that you have to breathe into, which is, I'm supposed to get up to 1,500. Usually the first time I can't get it up. I had to keep doing it, so that means my lungs need to open. So, definitely do that. And I usually cough, but I've been up walking more this evening, so it's probably a good thing. But that was pretty much the experience at the hospital. Of course, they give you, they gave me bags of antibiotics. I had IVs going for 2 days straight, David said. And a big old bag of vitamins. It was orangish yellow looking. And then the Tylenol. It was Tylenol and something else. And it helps with the swelling and the pain, which is good. So, that was my experience at the hospital. I'm sorry I couldn't take much more pictures of it. But, I'll let you all know how I sleep tonight and everything. I'm waiting on my charger to get here for my laptop so I can splice all these together. So, hopefully it won't be too chopped up and too crazy. I was going to show you it's kind of on my arm. That's how bad that one is. I have bruises all over me. Just where they poked everything. I had one on this arm too. But this one kind of gave out before. But I look like I've been in battle. I may show you my incisions later. I don't know. It don't look too bad. You know, it looks like everybody else's. It has the little butterfly things over it with the glue. So, and it's not too sore. But I'm home and doing good. It was nice to get outside and walk. But I will talk at you guys later. Bye-bye. Hey, YouTube. Something I wanted to talk to you guys about, it's very important, is this right here. It's Biotene. You can get it in toothpaste, mouthwash, and something else. This was a lifesaver. All you pre-oppers out there, people that's fixing to have your surgery, make sure you take this with you. Of course, do not swallow it. It's just a mouthwash, and it helps dry mouth. Monday, when my mouth was so dry, and Tuesday morning, what I did was, you know, until I had my swallow test, I would rinse my mouth out with water, spit it out, and then rinse it with the Biotene. This was like $3 and some change at Walmart. That would be my number one thing I recommended. That's what got me through, because my mouth was so dry. It was awful. It's the driest my mouth's ever been. But that right there helped it, made it feel better. I was more comfortable. Of course, it's better for your teeth too and everything. So, just wanted to add this to that because I think I talked about it a little bit, but not enough. And you only have to squirt just a little, like a teaspoon under it, and swish it in your mouth, and it is wonderful. It works okay without swishing it with water, but it works better with swishing water. So, do not swallow it at all. Swish your mouth with some water, spit it out, swish it with the Biotene, and gargle, but do not swallow. And you can do it up to 5 times a day, it says on there. And I think I did it 3 at the most on Monday when I couldn't have nothing at all to drink or eat. So I just wanted to add this to my little video. Talk to you later. Bye.